All right, so following up to my previous video about throwing your back out, symptoms and signs related to that, I covered that. But right now, I want to talk about you threw your back out, and now what? So you're doing whatever, you feel that spasm in your back, it catches you, it gets you off guard, it feels like junk, and now what? Well, I'm going to go over some top things that I recommend with my patients that they do when they throw their back out. Hang with me, and in about 2.5 seconds, we'll go over it. All right, so first, I just want to start off by saying I'm sorry, right? I'm sorry that you threw out your lower back and you're going through this discomfort sitting and watching this video or standing or whatever position you can get in. You've probably got that hot pack on it. You've probably considered taking medication. You're trying to move, you can't. You're like, man, do I need an image or MRI? What's it going to be like in a couple days? Can I go to work? All of those things should be circling through our head because we're human beings and those are the things that we have to do in our normal life. But I could tell you threw out your back and it's okay. Yeah, it'll be okay. You've probably done it before and it gets better every day. It's not going to typically take that 6 to 8 weeks that we normally see for tissue healing time because just a little strain in your back and that musculature will heal up very quick because you've got a lot of blood flow there and those muscles are used to contracting. And so you overdid it, you did something, we don't really know what, and it doesn't really matter, but now you're feeling that, but it will get better. And so what do you need to do when you throw out your back? You need to get some assurance, right? And so normally that assurance comes from your past experiences, knowing that you've done this before and you've been through it, but it will get better. And that's type of a mindset that we need. Some people also need, somebody to take a look at them, right? You want to get into your doctor fairly quickly or someone or a medical professional that is very equipped to evaluate back pain. And so I specialize in back pain. And 50% of the time when I see people with same day visits and they're like, hey, I did something to my back, it's that throwing out. It's just a lot of assurance, right? I check your nerves, I make sure everything is good to go. You don't have any red flags. And so red flags are the significant progressive weakness in your legs, the bowel or bladder changes, inability to sleep, history of cancer, like all of this stuff that we consider in our head. And we're weighing the risk ratio reward to wait and see or getting an advanced imaging early. You most likely don't need imaging. When you compare medications, so NSAIDs to opioids, so the non-steroidal anti-inflammatory drugs, when you compare those to opioids, actually the regimen of the non-steroidals actually tend to come out on top because of the pain relief, but also the risk of adverse events. And so those are not medications that you're on all the time, but they have their place when you're experiencing this level of discomfort. And so use them to whatever your doctor has recommended in the past, or get on a telehealth visit and just get their insight on that. But those are good over-the-counter medications to use. Ice or heat. And so I always tell my people who have some sort of strain in their back or throw out their back, you're going to want to get on that heat train. And so the heat train, because the hot shower feels good. If you got a jacuzzi, you lay in that and that feels good. But that warmth feels really good. And so it just relaxes the musculature there because that spasm is that muscle from grabbing and it really doesn't want you to move. And it's just trying to protect itself. And so using that heat to help calm down the area and give you some of that feel-good moment when other things in your life are definitely not feeling good. So if you throw out your back, it's most likely not anything terrible. Actually, 90% of the time, 99% of the time, it's really just going to get better on its own over time. But the encouragement of that healing is important, so you can use that heat, the non-steroidals, and then every day you should notice that you're getting a tad bit better, just a tiny bit better, a little bit of wins every day. Knowing that you're able to walk a little further or get up with less pain or less catching throughout the day and less spasm. Our goal is to get moving, and that is the absolute goal that's been proven over and over again to help you. The biggest thing to prevent back pain and really musculoskeletal injuries in general is the more active and stronger you are, the less vulnerable you're going to be, and your spine's going to be less vulnerable. And so you've got to take care of yourself. That's the end goal. Here's where you're starting, and that pathway in between should be linear. So you should notice every day you're feeling a little bit better. If you need somebody on your side, go grab somebody, right? Physical therapist, massage therapist, chiro. Those are all people that are fully equipped to help you manage some of that back discomfort as you're getting through it. Even if you just pick their brain and get some assurance and have them take a look at your body, that goes a long way. And that's what I've spoke to you about in the past, right? Using direct primary care providers because they give you that time, they give you that assurance if you really want to see a physician. But when you're looking at the other professionals that are very well equipped, they could be physical therapists like myself, chiropractor, massage therapist, anybody that's more conservative in nature, because that conservative care has been shown to be best for back pain. And so pick those people's brains, learn your body, know what's going on, know that you're going to be okay. We keep an eye out for those red flags, but when you have some sort of back throwing out moment or spasm, your brain can start getting a hold of you a little bit, and you can have these negative thoughts come through, but just know it will get better. And every single day it will get a little bit better. And as you're feeling better, you get more and more active. And then once you're back to yourself, you really got to get on that program to keep your back strong and resilient. So I posted a video in the past about like a good 10-minute workout that you could do. I'll try to put it in the description here. So take a look at that. Just give your body some love, build that resiliency so you don't have this happen again, because it gets frustrating. You don't want to go through this stuff again. And I love treating back pain, but I also love seeing people live their life without having that recurrent back pain. And so take it for what it's worth. Know it will be okay. Things will get better, but when you have that catching moment, that moment where you feel something in your back and it just grabs you in the next 48 hours, I wish I had a better solution for you, but your body's just got to run its course. Your body's very strong and resilient, and sometimes it needs some love by other providers, heat, non-steroidals, and just gentle movement overall. And so if you like what I'm saying and you have been through something like that before, you understand that it will get better, please subscribe to the channel and just better support me being able to get some of this information out there, because I love just giving people that little bit of confidence to move forward and know that things are going to be okay. And so until next time, just stay healthy, keep moving, and take care of yourself.